Hello, everyone, and welcome to this discussion with the FierceHealthcare team. We've been talking a little bit about some of the different changes that have been taking place since the COVID pandemic began, and we wanted to share some of our thoughts about what we've been seeing, as well as some thoughts about what may be here to stay after COVID hopefully becomes a distant memory. So first of all, I wanted to introduce each one of our editors here at Fierce Healthcare. We've got Heather Landy, who leads up our IT coverage. We have Paige Minnemeyer, who leads up our payer coverage. And we've got Robert King, who covers our regulatory and our provider coverage. And I am Tina Reed. I am covering our practice management today. And so let's get to it. So for starters, what are some of the biggest changes we have been seeing in healthcare? Let's start with you, Heather. What have we been seeing in IT?
Sure. So probably not big news to anyone, but we've seen rapid increased adoption of telehealth by providers and by patients. Hospitals, health systems, and physician practices have all been turning to telehealth to see patients virtually under all these stay-at-home orders and to prevent patients from coming into the hospitals and to the physician practices. Lots of adoption of just all sorts of digital health tools. And along with that, CMS has relaxed a lot of restrictions around telehealth reimbursement, has expanded access to telehealth by paying for a lot of telehealth services at parity to what they pay for inpatient services. So that's one of the big changes I've seen.
Great. And Paige, what are we seeing on the payer side?
Heather kind of touched on a little bit of it, but private payers as well as CMS have been trying to make it easier for providers to offer telehealth and boost access to that as people are encouraged to stay at home. A lot of the private plans have also taken steps to ease, prior authorization and other kind of administrative barriers that can really hold back providers in terms of their kind of volumes and pushing information through. They're doing a lot too with, just kind of information and access to members because they have kind of a direct through line to their membership. They can kind of keep them informed with what's actually real facts from the CDC, from the FDA, and kind of keep them informed on how benefits are changing and things that are changing. A lot of these steps are temporary is kind of the thing to think about though. So they, a health plan that expanded its telehealth benefit may be cutting that off in May or in June. So that's kind of the trend there.
Great. And Robert, what are you seeing?
So I'm seeing right now among providers a massive kind of financial and cash crisis, specifically caused by the COVID-19 outbreak. Pretty much all states have canceled elective procedures last month in March. And while some states are thinking about reopening and allowing hospitals to resume those procedures, that's caused a major financial hit to hospitals and to providers that rely on that revenue. Another problem is there is low patient volume right now at all hospitals, except for, of course, COVID-19 volume. So that's been another cash crunch as well, which has also led to providers kind of shifting more towards telehealth to try and speak with patients and everything that aren't comfortable going to a healthcare facility or a waiting room right now. So that's kind of the main cash crisis that they're happening right now. There's also questions about multiple rounds of funding that are being distributed. The President Trump just signed, I think about an hour ago, a massive $75 billion in funding to hospitals, which adds on another $100 billion that was passed by Congress a few weeks ago. So there's also questions about how providers can get that money and whether or not it's going to be enough.
Yeah, well, and I know specifically for physician practices, it's been a huge cash crisis as well, with, a large number of them reporting that they're seeing their outpatient services dropping. Their overall, financial situation is so bad that they're laying folks off or doing furloughs. They've just also been trying to change up the way they provide services to patients, either by trying to shift everything to telehealth or as much as they can to telehealth. And then for those patients who actually have to come in to get seen by a doctor, making them wait outside or in their car in the parking lot, and then they'll call them in when it's time to come in rather than sitting in a waiting room. And so it's just, you've seen kind of this change in the way they've been trying to deliver care that doesn't really necessarily make financial sense for a lot of the payer, or for a lot of the providers, at least those that are still in the fee-for-service model. So that's definitely what we've seen. Is it's definitely been a big cash crunch for the doctors. I guess the big question that's on a lot of people's minds is, okay, so we're seeing all these changes that are happening under COVID. Obviously, everybody's feeling it. We're all in our homes right now. What is going to stick? What's going to stick around? And obviously, we don't have crystal balls, but I'm curious what you guys think in terms of what we might actually see kind of change healthcare for good. So I guess, what are you guys seeing?
I'll just jump in and say, I think this rapid increased adoption of telehealth is going to be here to stay. I think doctors and patients realize that it's really a new option for patient care. I think patients are seeing the convenience of it. I think doctors also are seeing that it's a good option, and you don't necessarily need every patient to come into a doctor's office for every visit. And I think also, even after we pass the emergency period of COVID, for a long time, there's going to be a demand for not having crowded waiting rooms and not having too many people coming to the doctor's office. So along with the increased use of telehealth, I think we're going to see things like virtual waiting rooms where people can check in for appointments from their homes or their cars, just to keep people, to keep those waiting rooms from getting crowded. I think the big question moving forward is whether these changes by CMS and commercial payers are going to stay permanent, or if they're only going to be temporary, because CMS has said a lot of these easing of restrictions is only during the COVID pandemic, during the health emergency. But I think there's going to be a lot of pressure from providers to make these changes permanent, and they're going to want to be reimbursed for these services going forward.
And I think you're right. I mean, it's like, how many people have not used telehealth before, and now that they're realizing, wow, it's really easy. Mm-hmm. So I wonder how much pressure that is going to put on payers to kind of keep the reimbursement going for these sort of services in the future.
Right.
I mean, I think that's, if we're talking about the changes that are going to stick for particularly the commercial payers, I think that's really the only one that we could see long term. I think, when you talk to these companies, they are really committed to this telehealth expansion, in part because long term it also is less expensive than a hospital visit or a visit to the doctor, regardless of a pandemic. So I think there's a lot of pros for that in the future. Otherwise, though, I mean, I really think it's going to just kind of be back to business as usual for a lot of these health plans once we get past the kind of initial short-term impacts of this pandemic. They're going to navigate, as you were talking about before, the impact of the decrease or the pause on, non-essential services and kind of, surgeries that maybe have been pushed off. And they're looking at, the end of the year, early next year, as maybe really feeling the financial impacts of that. But I think once they kind of navigate those processes, I mean, they're going to circle back to where they were. I don't really see a future where they relax prior authorization long term. I really don't see a future where they kind of move away from these tools that they've utilized for so long. But I think you're right, though, that there will be pressure to do that, and it will be kind of, the question is, are they just going to flat out say no, or are they going to maybe meet providers in the middle and say, all right, we're not going to eliminate prior authorization or relax it to the degree that we did for COVID, but maybe we'll give you a break, or maybe there's a way we can kind of meet each other on that. So I think that's plausible.
Yeah, no, Robert, I mean, what do you think is going to maybe stick with some of these CMS changes that have come up?
Yeah, so the major question, I think, right now that I'm still wondering about is how CMS's value-based care programs, more specifically accountable care organizations, are going to weather this storm. There was a recent survey from the National Association of ACOs that said that 56% are either somewhat likely or very likely to just close and not participate in the value-based care program because of losses that they have to face due to COVID-19. So just a quick reminder, ACOs agreed to kind of share in financial risk, where if they don't meet certain spending targets or Medicare spending is far too high, then they have to repay Medicare for any of those losses. But if they save money, then the ACO gets a share of any of those savings. So the problem with COVID-19 is that it has completely thrown asunder any types of known utilization costs and things like that. I mean, nobody was planning on a pandemic when they set payment benchmarks about a year ago. So, a major question is whether or not CMS is going to give more regulatory relief for ACOs. Some members of Congress have been asking, alongside the National Association of ACOs and other provider groups, want essentially a mulligan for 2020 and even for 2021, where they're not on the hook to repay Medicare for any losses. So that's going to be a major question mark, is if CMS is going to help ACOs more, and if they don't, are we going to see an exodus from that program? And is that going to, the long-term ripple effect is that going to make providers, wary down the line of entering into a value-based care program when a major event like a pandemic, could happen and they're on the hook for a lot of money?
Yeah, that's true. At the same time, though, like when I was talking to Oak Street Health this week, they're a Chicago-based primary care company that they solely focus on the Medicare population. They work in disadvantaged communities, and using this value-based care model, almost solely a value-based care model, they've actually found that's been their saving grace during COVID, because they work with commercial payers that basically want them to kind of own this population and make sure that, and they pay them based on outcomes. And so they haven't seen this precipitous drop in how much money they're making during COVID because they're not depending on that fee for service. And so they've been spending their time trying to check in with patients and show them how to do telehealth. And actually, it was interesting when you were talking, Heather, you talked about how patient expectations are changing. They realized that they can do telehealth via the telephone. I mean, a lot of their patients are older. They don't necessarily have smartphones, but they do have the telephone, and there's a lot you can actually do via the telephone. And if you're not worried about whether or not you can bill for that time over the telephone, that's actually a pretty easy option for delivering care and checking in with patients. So that's just been kind of an interesting change. So for those that have kind of made that swap to value-based care, like Dr. Farzad Massashar from Aledade made the point this week that this would be the case for value-based care in that situation. So I don't know. I think that's interesting.
Oh, Heather, you're on mute.
Thanks, Robert. I actually wonder if this is going to spur more practices to go into value-based care arrangements, because as you've said, it's really kind of made the case for how, Dr. Mostashari said that practices in value-based care arrangements are going to be in a much better position. So,
yeah. Let's see, what else is there anything else that we can say really about what's going to change for providers, Robert? I'm curious how we see this kind of playing out now that we're starting to see states open back up at least a little bit, and how we're going to kind of see this play out with elective surgeries.
Yeah, so right now, CMS put out guidance for how a hospital or health system can restart elective procedures. And they preface this by saying, this is only guidance. Please do this in conjunction with your state and local authorities on making any final decision. A big part of their guidance was testing. to ensure that you had adequate capacity to test people that are coming into the hospital for COVID-19. Another issue was make sure you have enough PPE, personal protective equipment, which has been a sore issue for a lot of providers to kind of figure out how to get that equipment as well. So that's going to be, I think that testing and whether or not hospitals have the capacity and are comfortable enough to reopen is going to be the biggest linchpin for whether or not these elective procedures kind of come back. And right now, that's a question mark. I know there's some states that are, started a phased. I think that there have been about 14 states that have submitted plans so far to start the phased-in approach, and some have just decided to just reopen no matter what, like Georgia, which is what kind of decided to try and reopen a lot of things, and also resume elective procedures starting today, actually. So that's going to be testing, I think, is a thing to watch out for when it comes to when systems start to resume elective procedures.
And really, it's going to be on a hospital by hospital basis. I was talking to a health system that was saying, listen, in one state, they might have enough PPEs and enough testing and not really have that many COVID cases. And then it's going to be totally different in another state with some of these major health system players. So that's definitely going to be kind of a case by case basis. I wonder what's going to happen with supply chain too, just with this just in time ordering. It's just not going to work at some level anymore. People had an expectation that we would have had enough PPE sitting around, that like there's been confusion, like how did we not have enough of this? But I think it's really kind of shown those vulnerabilities in our supply chain and just kind of how we make healthcare run on a regular basis outside of pandemic situations. So, well, that's been a lot of really great stuff. I really appreciate you kind of trying to take a look and see what's going to change in the future. I'm sure we're going to circle back around, and definitely we want to hear from our readers. And what do you think is going to change, or what do you think is going to stick from some of the changes that have been taking place under COVID-19? So let us know. Shoot us an email, and we'd love to keep the conversation going. Thank you, everybody, for watching.
Bye, everyone.